Greetings and welcome to the weekly Grand Rounds educational podcast from Sinclair. And my name is Jim Ellermeyer. I'm a behavioral health therapist here at Sinclair, and today I'm joined by
Maura, PA student.
And
Sarah, PA student.
And today what we're going to be discussing is a topic that quite often is not addressed, and that's the families that deal with an individual who has a mental health disorder. And I don't know whether anyone out there, but mental health disorders are so common in this country, and having someone living in your household like that can be quite a challenge. And one of the things that we've found here at Sinclair is that given the fact that many service individuals are returning from areas where there's been combat, where there's been violence, where they've either participated in it or even witnessed it, they can come up with a condition called
PTSD,
which is
post-traumatic stress disorder.
Can you talk to us a little bit about that, Maura?
Sure. I focus mostly on post-traumatic stress disorder and its effect on the family, although it is something that can be very profound in how it affects the person that has it. It is also something that greatly affects the family as well. Family members often find it very difficult to understand what is going on, as well as understand how to cope with their family member who's going through this difficult time. They often feel helpless and don't understand the symptoms. So what I did is kind of focus on what they can do in order to help their family member, as well as being aware of the link between PTSD and the effects on the family. So just with how PTSD affects the family as a whole, there have been links with greater anxiety, unhappiness, marital problems, as well as behavioral problems amongst children of those with PTSD. Their behavior can oftentimes be erratic, upsetting, and this is something that's really difficult for those that have not experienced the events that they experience to understand. So the role of the family really seems kind of simple, but it is much more difficult to understand that unless you've been through something like that. But they have to be able to first learn the symptoms of PTSD, so realizing that they're going to have the upsetting thoughts and memories, the recurrent nightmares, the flashbacks, strong feelings of distress when reminded about that event, or just kind of being completely closed off in general. There's often times when they will not necessarily ignore, but they kind of lose interest in what used to be normal because it's not normal to them any longer. So they have to learn those, and they have to understand where they're coming from. They also have to be able to understand that the behaviors that are being that the person with PTSD has may not necessarily reflect how they truly feel. It is also important to know what the triggers are. So oftentimes these people can be triggered by loud noises if it's something like combat. If it's someone who suffered some sort of traumatic hospitalization, they might not want to seek care again. So it's important to know what that is. It's also important to realize that you might have to change your routine. So you might, if someone is having recurrent nightmares, especially those that have been in war or combat, you might want to find other ways of waking them rather than physically trying to wake them. That often gives them the feeling that they're being attacked, which can result in adverse effects. So it is important to realize that PTSD is the body's way of coping with an extreme stress. I also did kind of look a little bit into PTSD and the relationship that it has with violence in the family. There is a strong correlation between those that have PTSD being in either abusive relationships or just taking out their aggression in other forms. So it is important that when someone seeks treatment, that they're also oftentimes going to include anger management skills as well as more healthy ways of coping with stress. So it is important to kind of realize what is also linked with PTSD and what you can do and how to seek aid for those in your family.
Yes, and I happen to sponsor an individual in 12-step recovery that spent tours of duty in Iraq as a sniper, and he certainly has that. So what do you do, Sarah? Do you go ask the neighbors what to help? Do you ask them what you should do? What type of support is out there for families?
There are numerous support groups out there that can help family members that are family members of individuals with mental illnesses. I'm going to speak of one specifically. It's called NAMI, N-A-M-I. It's the National Alliance on Mental Illness. And basically, it's a group that you can go to either monthly or weekly for those that are 18 and over that have, basically, if you're a family member, a caregiver, or just a loved one of someone with a mental illness, you go to these groups and they can basically help you cope with the issues that you're dealing with, you know, with the issues that you're dealing with. So basically, there are other people. It's a peer-led group, and there are others that are kind of going through the same thing as you are. And there's a group discussion, and people come and speak about what they're going through, and it's an open discussion for you to speak about what you're going through. And in that way, you can find support. You can learn ways to cope, or just it's basically just a learned experience. It's kind of like a group wisdom experience. So that's a great way if you are dealing with someone with if you are a loved one of someone with a mental illness, you can go ahead and go to one of these groups, and that can help you deal with that.
Absolutely, and sometimes you feel like you're so alone that you have no one to turn to, you have no one to understand. You may talk to your neighbor, and there's such a stigma against for mental illness out there, that people view people with mental disorders as less than. And one of the things that a particular group that you spoke about, Sarah, is that they understand. They understand. It'd be like me, a pregnant woman coming to me and talking to me about being pregnant. And could I say, I understand? I do not. How could I possibly? So what you're dealing with people who do understand what you're going through. And what they can do is share their experience, strength, and hope in dealing with that situation with you. So what we'd suggest for families, and this is things that we particularly stress here at Sinclair, is that you educate yourself about the illness. Educate yourself about the illness. Don't listen to what other people have to say about it. Find out about it about yourself. Seek out resources, and we will be posting a listing of resources on our website where people can get support for these type of things. Have realistic expectations about the individual that you're working with. And please, this is so important to reach out for support. One of the things that we insist on in Sinclair is working closely with your loved one's treatment team. Don't guess, don't ask. The patient, ask the people who are treating your loved one and find out exactly what's going on with them. Letting your loved one have some control, letting people have some independence in their lives, allow them to take back their choices. Encourage them to talk to their mental health professional should they be having issues with their medication, whether they're feeling sick. If they're talking to you, you could talk to the mental health professional. We need to know. Knowledge is key. We can't read minds. We have no idea what's going on with individuals unless they tell us. One of the things is to set appropriate limits in your house. Set appropriate limits in your house. Let individuals know what behavior will be tolerated and what people will not. And realize that feelings of shame and guilt are normal. When you're feeling shame, when you're feeling guilt, when you're feeling depressed, that's normal. That's okay. It's a lot. You're allowed to have those feelings. And understand you establish behavioral contracts, behavioral rules in the house that have to be followed by everyone. Outbursts of anger will not be tolerated by anyone. Drinking alcohol, using drugs will not be tolerated by anyone in the house, not just that particular individuals. And recognize your loved one's courage. It takes a lot of courage to get help. There's a big difference between asking for help and accepting it. And we've all heard the pleading, the screaming, the crying, the begging, the yelling, the threatening. It's through encouragement and support that you will provide your loved one with the best environment. And also, please help yourself. One of the ideas is please take some time out and be good to yourself. You cannot give something that you do not have. And this is one of the most difficult ones, is to be calm, And here at Seclair, we instruct people on the concept of using a wise mind, where people learn how to respond rather than react to situations. Convey hope. One of the first prescriptions that we write here at Seclair, Dr. Chaudhry has a huge warehouse full of these prescription pads, and as one of the prescriptions we write for is hope. Also, advocate. Advocate for your mental health patient. Advocate for your loved one. It's so important to let the politicians know, let the people in power know that folks need help out there. Mental health programs need more funding, need more outpatient services. Advocate with them to the insurance companies. Those things are so important. And again, we will be listing the list of support groups. It's quite extensive. We're going to be putting that on the website. Have you ever had an experience with anybody with mental health in any environment that you've had, Sarah? Excuse me, Maura?
I have family members that are in the military, and so I've experienced the effects of PTSD, not only in families but in those friends and things like that. So I've definitely experienced that from the family and friends side, and it can be difficult to deal with. Especially, I can definitely say that I've felt that kind of hopelessness where you don't really know what to do for that person.
Well, normally when you're dealing with it, they go along the basis of Al-Anon programs, which are for families of individuals who are affected by loved ones with the disease of alcoholism, and that they didn't cause it and you cannot cure it. Okay? So the idea is to take that guilt off of yourself and reach out and get support. The support is out there. My suggestion is that you take the action and effort to seek it. Any thoughts on that, Sarah?
No, I completely agree. I mean, I definitely have had loved ones that have suffered from a mental illness, and it does affect you. As they go through what they're going through, but it also does affect you personally, and it's really hard to deal with those types of things alone. And it's good to get support, to get advice, ways to cope, that we can get through that time instead of kind of suffering through it. It's always better to just ask for help and see if that would work for you and if it can help you through the time that you're going through.
Sure, and if you get frustrated with a loved one, if you get angry with a loved one, if you feel that you're at the end of your rope, those are normal feelings and normal emotions. It's okay to have emotions, and they're yours, and nobody can tell you that they're nonsense or that they're foolish or you shouldn't be feeling that way. However, perhaps when you go to one of these support groups, you can express your frustrations, express what's going on in your family with your loved one, and that person is going to say to you, you know what? You're not the Lone Ranger. And they might share a little bit of their story. However, what they're going to tell you, what they're going to do about it. These support groups are all about the solution. They are not about the problem. They are about the solution. So we're certainly glad that everyone joined us this week, and we're going to ask Miss Sarah.
To continue the conversation, please like us on Facebook, plus on Google+, or follow us on Twitter under Seclair Life, and keep an eye out for any of these on our next live recording, Mondays around noon, and ask your own questions. You can also find this and other grand rounds on YouTube/Seclair Video. YouTube.com/Seclair Video, and find audio versions on iTunes, Stitcher, Spreaker, and iHeartRadio. And please visit us at www.seclair.com for more information about us and other articles on our great blog.
And we'll leave you with the prescription that we always write each week, and that's fruit, nuts, and vegetables. Unplug your television and perhaps take up fishing. And my friend Sven and I will be doing some Zen fishing this weekend, which is fishing without bait. So take care and be good to yourself.